It's Thursday, December 5th, and this is the Daily Medical News, where we bring you clinical medicine's top stories, plus a closer look at the day's biggest story. I'm Molly Collegio.
And I'm Terry Rudd. Today, efforts to reduce new HIV infections have stalled.
Cardiac arrests peak with more pollution.
Biomarkers might predict which bipolar disorder cases will worsen.
And how allopathic and naturopathic providers differ in their approaches to atopic dermatitis.
Plus, new research could quantify just how EHR usability, or the lack thereof, contributes to physician burnout. And now, the news.
Progress in reducing the number of new HIV infections has stalled, and few Americans who could benefit from pre-exposure prophylaxis are receiving it. Those are the cautionary findings from a new CDC report on HIV testing and treatment in 2017. The report also shows that many Americans with HIV aren't aware of their status or aren't receiving effective treatment. The CDC researchers found that approximately 154,000 people with HIV didn't know they had the virus. That's 14% of the total population with HIV. 63% of patients who knew they had HIV had the virus under control through effective treatment. Young people and African Americans were least likely to have the virus under control. And about 1.2 million Americans could benefit from PrEP, but only 18% of them had received a prescription for the drug. The eligible groups with the lowest rates of coverage were young people, African Americans, and Latinos. Dr. Jay Butler is Deputy Director for Infectious Diseases at the CDC. He says HIV prevention progress has stalled in America since 2013. To get things moving again, the CDC has proposed an initiative called Ending the HIV Epidemic, a Plan for America. The goal? Cut new HIV infections by 90% by 2030, in part by expanding access to PrEP medications.
Out-of-hospital cardiac arrests spike with higher counts of emissions-related particulate matter. And that increased pollution takes a particularly high toll on men and people older than age 75. That's according to a nationwide Japanese study presented at the American Heart Association scientific sessions. The particulates are a key contributor to urban smog, and researchers at Kawasaki Medical School in Kurashiki, Japan, say short-term exposure to them is a potential trigger for out-of-hospital cardiac arrest. The investigators examined the link between cardiac arrest incidence and particulate matter that measures 2.5 micrometers in average diameter, or PM 2.5. PM 2.5 is about 1/40th the diameter of human hair. Across Japan, the average daily concentration for PM 2.5 was 14 micrograms per cubic meter. The researchers found that a 10 microgram per cubic meter increase was linked with a 1.6% increase in out-of-hospital cardiac arrests. And in cardiac arrests, greater PM 2.5 levels were linked with lower rates of restoration of spontaneous circulation, 1-month survival, and 1-month survival with minimal neurologic impairment.
Several potential biomarkers could identify patients with bipolar disorder who may have high recurrence disease with a progressively shortening cycle length. Researchers at the Gothenburg University in Sweden studied biomarkers in patients with bipolar disorder who had at least 2 inpatient episodes separated by at least 8 weeks. They clustered patients according to frequency and cycle length. The investigators defined low-frequency recurrence as a maximum of 1 inpatient episode per year. Sensitized patients had progressively shorter periods between inpatient episodes. There was no difference in biomarkers or clinical features between high and low-frequency recurrence patients. But in a cohort of patients who were both sensitized and had a high recurrence rate of at least 5 inpatient episodes, 4 proteins were expressed at a significantly lower level than that of non-sensitized patients. The investigators say the results could lead to research aimed at preventive approaches. The findings appear in the journal European Neuropsychopharmacology. We'll be back after this message with more medical news.
Allopathic and naturopathic providers use similar strategies to diagnose atopic dermatitis in children. But when it comes to treatment, they diverge in their approaches. Those are the main findings from a survey of 30 allopathic and 21 naturopathic providers conducted by researchers at Oregon Health and Science University in Portland. Studies showed that more than half of atopic dermatitis patients have used complementary and alternative medicine in addition to allopathic care. But providers may not be aware of each other's treatment approaches, and that can be confusing to patients. Allopathic and naturopathic providers alike recommended skincare protocols involving moisturization and soak and seal bathing. But while all of the allopathic providers said they'd prescribe topical corticosteroids for mild to moderate disease, only 19% of naturopathic providers said the same. Half of naturopathic providers said they'd choose topical botanicals, oils, or a probiotic as first-line treatment for mild to moderate disease. In contrast, none of the allopathic providers said they'd take that approach. Of note, 85% of naturopathic providers said they thought diet had a probable or definite role in AD, compared with only 3% of allopathic providers. The findings appear in pediatric dermatology.
There's plenty of anecdotal evidence connecting electronic health records to physician burnout. But new research puts a more standard, quantifiable measure to it. Research that could help measure progress in improving EHR's usability. Researchers at Yale University in New Haven, Connecticut, used the System Usability Scale to assess EHR's usability. Among 870 physicians evaluating their EHRs, the mean usability score on a scale of 0 to 100, with higher being more usable, was 46. In comparison, Microsoft Excel has a score of 57, digital video recorders score 74, and Amazon scores 82. Even microwave ovens cook EHRs, with a mean usability score of 87. And it gets worse for EHRs. Their score of 46 is in the bottom 9% of usability scores across studies in other industries. The investigators note that puts EHRs squarely in the not acceptable range, with a grade of F. To analyze the ties between EHRs and burnout, the researchers turned to doctor scores on the Maslach burnout inventory. EHR usability scores were strongly and independently tied to doctor burnout scores in a dose-response relationship. When usability went up, burnout went down. The relationship between usability and burnout persisted even when the researchers treated emotional exhaustion and depersonalization as continuous variables. The investigators cautioned that association isn't causation, but using the System Usability Scale could allow EHR stakeholders to measure improvement. And once you can measure something, they explain, you can manage it and make improvements faster. And that's it for today's daily medical news. Remember to catch the latest episodes of Dermatology Weekly and Blood and Cancer, available today and every Thursday. For MD Edge, I'm Molly Collegio.
And I'm Terry Rudd. Thanks for listening.